In the name of God, hello everyone. Good morning. It's a great pleasure to host you today. So, in the second day of the International Conference on Planetary Health, as a quick review of what happened yesterday, we had an introduction to planetary health. We also talked about planetary health in nursing and midwifery education, the changes in curriculum, and its needs. And then we talked about non communicable diseases such as cardiovascular diseases and so on, as well as one of the most important global concerns, such as antimicrobial resistance, which was related to infectious diseases. We had some experts from all over the world that talked about these kind of subjects. We also had a great attention to policymaking and how can we foster the culture of planetary health. One of the important topics was climate change, especially carbon dioxide emission, and also climate-induced disasters. We had a lot of global perspectives on Kenya, Indonesia, Germany, and Iran. We also introduced you some uh, global projects such as Sophia and Chance Network that were especially focusing on these topics. So I would like to ask our first speaker to start today's panel, or today's first panel, I'd better say. Uh, I would like to ask Ms. Nusha Saadat, Master of Science in Nursing Management at University of Medical Sciences, with the topic of planetary health and aesthetic leadership. So the floor is all yours, Ms. Saadat. Thank you for joining us.
Hello, everyone. Um, my name is Nusha Pursadat, and I would like to extend a warm welcome to all participants around the world. And I would like to express my sincere gratitude to all participants, um, in both Iran and other countries, to join us at this conference. I will be presenting on the role of art in planetary health in two sections, and I will discuss a study conducted by my colleagues and at Tehran University of Medical Sciences. And subsequently, I will discuss a case study of nursing and midwifery students about leveraging art to raise awareness, evoke emotion response, and inspire action. As you know, aesthetic is a mm, philosophical subject or philosophical concept. And to objectify this concept in organizational life and organizational health work and health system, um, and the people in the world of healthcare systems, such as families, people, and profession, um, we explore the opinion of a nursing leader and nursing manager. So the title of this study is exploring the place of aesthetics in organizational document and artifacts from the opinion of nursing manager and leaders in Tehran University of Medical Sciences. One of the objective of manifestation of aesthetics in nursing leadership and management is the use of aesthetic elements in organizational document and artifacts. Aesthetics in nursing leadership focus on creating beautiful and meaningful leadership, meaningful healthcare environment through design and organizational element. It means that shared creation of beauty and that enhance the healthcare experience. Aesthetics is not related just to beauty, and it's related something that it's sensory experience, regardless of whether it's perceptual or artistic. Therefore, um, aesthetically oriented organizational documents and artifacts are tangible manifestation of beautiful spirit that follow through the thoughts, heart, soul of a leader and can create in the organization. Um, the current study is a qualitative research with a content analysis method that uses Graham alignment approach. The statistical population of the research were nursing manager and leaders of Tehran University of Medical Sciences Hospital. Data was collected through semi-structured interview with 28 of these individuals. Um, we have three levels of nursing manager and leaders, such as operational and senior level and middle level. It means that head nurses, some supervisors, and director of nurses. Um, in the field of organizational document and artifact, paying attention to the current thinking and spirit behind the arrangement of document and artifacts, and setting up the environment in the organization through interview, photo voice, and field notes and field observation that participant mentioned that it's done. 191 quotes were extracted from this study, from the 28th interview, and after analysis, 6 categories were identified, including preservation, standardization, cleanliness and beautification, order and organization, and sublime. Although each of these categories hold a significant managerial implication of organizational work, due to the importance of the topic of art, I will focus solely at the concept of the last category about sublime that have two subcategory: transmission of aesthetic feeling and creativity and innovation. Okay. The conclusion of this study is that the spirit following the mind, heart, eyes, and ear and limbs of the aesthetic leaders felt by stakeholders in the design of organizational documents and artifacts, and creation of the aesthetics organization in clinical environments. External and internal beauty of organizational in the healthcare system and clinical environment will cause gentleness in the thought, speech, and action of the health provider and stakeholders such as people like patient families and other people. Aesthetic nursing care facilitates the process of the care and treatment and the feeling of being cared at home. Therefore, we have the definition of aesthetic organizational artifacts that created with the help of mind, power, and creativity to convey feeling in the format of component of harmonic. It's related to external beauty, according to stakeholders, and include usefulness, goodness, and pleasure is component of internal beauty. So we know that aesthetics have two components in the site of nursing leaders. It means that beauty have two components, beauty and sublime. And the aim of the aesthetic leaders is to facilitate the feeling of being at home. How is the aesthetic leadership linked to planetary health? As I mentioned earlier, I'll be focusing on the most significant finding of this study related to role of art in planetary health. The last category and the most category about aesthetic is sublime and internal beauty. Participants said that and discussed the concept of sublimity, which refer to transcendent and inspire quality about beauty. They describe how they sought to create a sense of evaluation and inspiration in their work through the use of symbolism, metaphor, and other creative expression. Sublimity was further divided to subtheme. Transmission, aesthetic feeling, that participants describe how they evoke a specific emotion and feeling through their organizational document and artifact. The example, uh, they use art such as poetry, music, and painting to effect on the emotion on the stakeholders on the organization. They use art as a platform for cultural effect of health, and they use art to convey health message. Um, Great, and the second subcategory is creativity and innovation. Participants emphasizes the importance of thinking creativity and innovativity to producing organizational materials. In this picture, we see a nurse promoting hand hygiene by supporting and installing an artwork on the wall. Just now imagine this. A head nurse is using a handmade or supporting and advocating a art project to a educational artwork about planetary health. The use of nature-inspired imaginary and art in this work. I think you are imagining a visual art that teaches the people the dimension of planetary health in this work. Academic and online research and resources increasingly highlighted the role of art in raising awareness about planetary health and expressing individual feeling on this topic. We have cited several of these resources in this slide. These resources provide a valuable insight to potential of art to engage people emotionally and inspire action and foster a deeper understanding of planetary health and issue. A nursing leader with a aesthetic perspective can play a pivotal role in organizational effort to safeguard the environment and planetary through creative, innovative implementation approaches. Also, they can do some things in policy making and something else with their advocacy and other things. We want to highlight the importance of art by nursing leaders to undertake effort to raise awareness of planetary health among our organizational stakeholders and patient families and healthcare professionals. Art is universal language, and I mean it's a common language. Art and nature is a common language between people around the world, around the earth, and is and they're intrinsically interconnected. Art serves as a universal language uniting people across the globe. Consequently, leveraging the potential of art as a common language to foster understanding of planetary health among individuals is highly recommended. Aesthetic nursing leaders inspired by art and nature are tasked with raising health awareness among individual families and communities through artistic tools, artistic eyes, artistic views, and keen eyes, such as Professor Charlie yesterday said they can significantly impact the healthcare culture and culture of society. These painting These paintings were created as a volunteer project at Roosevelt Hospital when I was master student. We aim to brighten hospital environment by nature inspired undamaged wall to provide comfort and beauty to patient and family. Thank you for your attention.
Thanks a lot, Miss Pursada. That was a very innovative topic. I really enjoyed, especially the last picture you showed us. It reminded me of a project happened in Children Medical Center, an education hospital of Tehran University of Medical Sciences in the COVID-19 pandemic. So in that project, the nurses used to wear uniforms because of the pandemic, and the children were scared, so they had to design it in a way with uh, cartoon characters, so they would reduce the anxiety of children, and that was really nice. The other point that you mentioned was really nice, was feeling, I mean, to feel being at home. That was really important concept in care. For a recap, I would like to ask Mr. Shayan Mahmoudi, Master of Science student in Emergency Nursing, Tehran University of Medical Sciences, to have an overview of Ms. Poursaada's speech for us. Over to you, Mr. Mahmoudi.
Thank you very much, Ms. Bulkat. This research was of point to me from a critical aspect, and it's that it's in a qualitative method. Qualitative research is very important in nursing research because these interviews can show us how much a concept is facilitated in our healthcare system. Actually, if you want to expand a newer concept like planetary health in your healthcare system, in your between your healthcare workers, it's very important to interview with them and see how the feasibility and acceptability of these concepts are among them. And this is especially true about planetary health. Another thing is that making things even 1% better in nursing care, in healthcare, is of importance to us because even one patient's life is of importance for a family. And these families can be big, can be 100 people, 200 people, and saving a life can help them live better, live happier, and even continue to do more in their lives. And these people can help others themselves. So this is like a chain, and this chain can save a lot of lives by itself. And even one more life is of dire importance in our healthcare system and every other healthcare system all around the world. Another thing is that when we are talking about aesthetic leadership, we are talking about vertical transfer of newer organizational habits and behaviors, because when a leader treats in a practical way, treats in a newer way, others who are working under him or under her know that these kind of behaviors are accepted and are appreciated in our system and are more keen to actually develop these kind of behaviors in their work too. So I thank you. And now I want to ask Ms. Bluka to introduce the next speaker of ours.
Yes, Sabrina, are you with us?
Hello.
Hello, Sabrina from Tehran, Iran. If you are ready, I would like to present you.
Yes, yes, I'm ready.
So please correct me if I said anything wrong, but Sabrina is a medical student in Catholic University of Health and Allied Sciences from Tanzania. She would speak about climate first experience from planetary health in summer school, right?
Yes,
So very nice. We also wanted to do this climate fest in Tehran University, and we are looking from your for your insights and your experience from this summer school. Please tell us how was your approach and tell us about your presentation. Thank you very much.
Okay, thank you, Baha. Good morning, everyone. So my name is Sabrina Lintu. Just as Baha said, I am a medical student doing my 5th year in the Catholic University of Health and Allied Sciences. And I'm going to present about climate first experience from summer school Planetary Health 2024 methodological approach for medical students. So this was a group teamwork because the medical students that went to German for the Planetary Health summer school were 5. Yeah, the names are listed here, but we also had supervision from Dr. Eva Maria, together with Dr. Elias Nyanza and Dr. Janet Peter. So in my presentation, I'm going to talk about the background of Climate First, the methodology, the results, together with discussion and conclusion. So to begin with, climate change is a significant health threat globally, and to respond effectively, it is crucial for us to understand its underlying causes and impacts first, and that's where Climate First comes in. So Climate First is a science-based collaborative and educational workshop that takes approximately 3 to 4 hours to help participants understand the causes together with effects of climate change. So it is based on scientific findings on IPCC, in which IPCC stands for the Intergovernmental Panel on Climate Change. This is a group of scientists who collect information about climate change from different studies. Then later on, they help the government, together with people, understand what's really happening, the causes of climate change, the effects, and the solutions. So Climate First obtains its findings from the IPCC, and this ensures that the information it teaches is reliable and up to date. So far, more than 1.6 million people have been pressed, and there are more than 70,000 facilitators worldwide. 157 countries have been on board, and more than 50 languages have been translated. So Climate First is it's getting really wide, and this is really good because it's a very good teaching strategy of climate change. So in the end of the workshop, participants are expected to have not only gained a good amount of knowledge about climate change, but also want to take action to address the causes and effects of climate change. So, what makes Climate First so special? So, Climate First is different from other ways that people can learn about climate change, like through lectures, because Climate First is like a game. So, when people, during Climate First, people learn about climate change, but also they have a good time doing it. Because as I said, it is like a game. But also, Climate First divides people into different groups, with each group having its own facilitator. So this helps the accumulation of different collective intelligence, because there are different people from different perspective of how climate change is happening. So this helps collective intelligence. But also it is scientific, as I said earlier, that it uses the information from the IPCC. So in September 2024, a group of medical students from KUHAS Uganda participated in a Climate First workshop, which was during the summer school on planetary health in Würzburg, Germany. And following an online, so after we did the Climate First workshop in planetary health summer school, we were interested in learning more about climate change. So we talked to Dr. Eva Maria and she helped us. We were able to do an online training to become facilitators, because before you become a climate first facilitator, you must first attend the workshop. So we attended the workshop, then later on, we did an online training to become facilitators. So following our facilitation training in October, we facilitated a press workshop in Kuhas for the SOFEA pre-conference in November. And participants were divided into small groups. There were 43 participants, and they were divided into two groups for a 3-hour session where we used 42 illustrative cards to explore the climate system under facilitator guidance, ensuring active involvement and understanding. Then afterwards, a pre and post workshop survey was done to assess the effectiveness of the climate risk. So this was us in October during our online training to become facilitators. Yes. And this picture shows one of the group during the SOFEA pre-conference. So this was one of the group that participated in the Climate First workshop. And this was one of the arrangements of the cards during the Climate First workshop. So, as I said earlier, 43 participants participated in the workshop, where 56% were females and 44% were males. And the participants were from different disciplines, ranging from health, education to agriculture. So results, pre-training, before the workshop, 63% of the participants had a basic understanding on the concepts related to planetary health and climate change. 26% had a good understanding, and 11% didn't know anything about it. So post-training, 85% of the participants reported their knowledge on the concept related to planetary health and climate change. So this shows that the Climate First workshop was a success because after the workshop, a good amount of participants had knowledge about the climate change. Moreover, the survey, 90% of the participants reported Climate First to be an effective tool for understanding broader impacts on climate change and effective for use in professional or educational settings to communicate about climate change and planetary health topics. So the 42 evidence-based cards are, in conclusion, the 42 evidence-based cards are an effective tool for educating professionals as well as students on the links of climate change, environment, health within the framework of planetary health, but also training students as facilitators fosters peer-to-peer education. Because from my experience, I saw this as it's a very creative tool, and I'm positive that students, if this tool can be used to educate students about climate change, apart from lecturers, students will be able to really understand climate change, because this really shows you what's really happening, like what causes the climate change, what are the effects, and it really motivates people to want to do some action about it. So this workshop is really good. But also the Climate First enabled 43 participants to engage in constructive discussion about climate solutions by developing a shared understanding of climate change mechanisms. And also the workshop fostered strong connections among participants, equipping them to pursue their identified climate actions. So at the end, this was a picture we took. The participants were really happy about the Climate First workshop. So I would say it was a success. And these were the references I used. And lastly, I would like to offer special thanks to the SOFEA Club for creating the Planetary Health Summer School, where we learned about the Climate First workshop, but also my university, KUHAS, together with AKC and KUHAS Planetary Health Club, for their support, taking us to German, which helped us learn more about climate change. Thank you.
Thanks a lot for informative presentation. We really enjoyed it. I would like to ask the audience if they have any questions to share us in the chat box. Thanks a lot.
Thank you, Mr. Lintu. That was a great speech. What comes to my mind when we are speaking about workshops and education is that how much we can implement novel models of education like focus group education, gamification, and other methods to improve the results of our education. I mean, how do you think can we implement these kind of models and these kind of approaches in teaching planetary health to healthcare system workers?
Hello?
Yes, we have your voice.
Yes, can you please repeat? I didn't hear it. The voice was very low.
Yeah.
The
Okay.
volume was low.
I was asking if
Yes.
you have an idea of how to implement newer methods of education like gamification, focus group, peer education, and these
Yes.
kind of models into educating people and healthcare workers about planetary health.
Yes. Sorry, did I get the question correctly? You say you're asking about the ways that I can use to educate people in my...
Yep, I'm just asking about that to know how can we use better ways to educate people.
Oh, okay, okay. So, well, climate risk is one of them because that's one of the best ways. But I think also, for example, in my university, I would advise integrating climate change into the curriculum so that students, apart from learning just about medicine, they can also integrate the climate change into the curriculum so that students can learn about what's really happening and how they can link medicine to climate change.
Thank you very much. I now want to see if Mr. Leonard Agan, are you ready for your speech?
Mr. Ogon, we would be really happy if you're ready for your presentation.
Yeah, sure, I'm very ready.
So perfect. Now we're going to host Mr. Leonard Ogon, Master's Candidate in Environmental Health, Research Assistant, University of Eldoret, Kenya, with the topic of Youth Engagement in Planetary Health. So the floor is all yours.
Thank you so much. I'll be sharing my screen in a while.
So we have your camera, your picture is clear. I would be happy if you could share your screen. And if there is any problem, we're going to solve it with our support team.
Thank you. When my slides are up, please let me know if you can see them.
Not yet.
Okay.
Now it's okay. Thank you.
Thank you so much, and thank you for the introduction. I'm so grateful for the opportunity that was granted to me to share my perspective on youth engagement in planetary health. So my name is Leonard Agan, and I'm based at the University of Eldoret in Kenya. And We work together with Malvin in our hub, in Planetary Health East Africa Regional Hub, and also with Planetary Health Alliance as the next generation fellow. This is a position where we work with other Planetary Health Campus ambassadors in different universities. So I'll be sharing shortly about that, but then I will focus on transformative actions that Planetary Health Campus ambassadors from Kenya have engaged in. I also work for the Department of Environmental Sciences at our university. So just 1 moment. Okay, I'm sorry. Let me go back to my slides.
That's okay. Take your time.
Okay, so I hope they're able to move. Good. So why do we talk about youth engagement in planetary health? And I want to borrow some examples of what we have seen in the region, that when we engage youth, they're able to shape a sustainable future because they really take responsibility and they are aware that this is our future, and therefore they really put a lot of energy in shaping a future that is sustainable. And they also take responsibility, and they really want to take care of intergenerational responsibility from one generation to another. And they're also careful about from their generation to the next generation. They also have new perspectives and innovative ideas that can help us to live a sustainable livelihood. They also take part in advocacy and various leadership opportunities. They're also useful in community mobilization as well as education. They also catalyze change. And we have seen that youth-led initiatives often spark more momentum for a larger systemic change. So let me go directly to what Planetary Health Campus Ambassadorship Program is. And I must appreciate all the presentations that I followed yesterday. They were amazing presentations. And time with time, I will hear presenters really focusing on youth engagement. And at the end of it all, we agreed that it is important to have that kind of engagement or arrangement where youth are also involved in matters environment and matters health and in matters planetary health. So this is a 1-year program that is awarded by Planetary Health Alliance. Planetary Health Alliance realized the importance of engaging young people, and therefore they have focused on young people who are either undergraduate and postgraduate students in various universities across the world. And it's a leadership opportunity that are awarded to these students to become champions for planetary health in their regions, in their community, and even in their universities. So at least those who are engaged in this program must be present in their learning institution between January to December each year, and during which this period they are able to organize at least 1 to 4 activities within their own community or within their own universities. And there are other meetings, mentorship programs that they also engage in to help them to develop professionally and even develop their leadership skills. So they engaged in reaching out to their own communities, even their faculty members and their various student clubs. And yesterday, as my colleague Melvin was presenting on various activities that the youths have engaged in, or the Planetary Health Campus ambassadors, we saw that they have several activities that are really enriching and that are really focusing on planetary health in the various campuses and even in their community. So these ambassadors, they are also included in the broad Next Generation Network that are composed of individuals of various academic and cultural backgrounds, different career stages, and people with different interests in planetary health. And they have leadership opportunity that are given to them, and they have an opportunity to attend even the annual meeting, the regional hubs activities, and we have other initiatives within the broader Planetary Health Alliance, including Clinicians for Planetary Health, nurses in planetary health, and other various initiatives within the broader Planetary Health Alliance. So who can be part of this program? And I've mentioned before, and I'm happy that this conference is having a broader audience, including the students and faculty members from various universities. And so any who is interested in this and is currently enrolled as a student can be part of this program, and it starts from January to December. And I've stated here now the next one is 2025. And students from various disciplines are encouraged to be part of this because we know that interdisciplinary, and it's also focusing from various geographical regions. So it doesn't matter from which region of this world you're coming from, you're encouraged to be part of this. And every person is actually expected to submit their personal applications. So you should be able to at least organize one to two activities every year. It can be a project that you thought of, it can be an outreach activity. And also we have various check-in meetings with their fellow campus ambassadors, where we allow these ambassadors to exchange ideas within themselves and share what current programs or activities that are engaged in, and this can allow one person to learn from the other person on what they are doing. And throughout the year, at least every month, we have calls where at least we have a speaker series, or we have, apart from the check-in activities, we could be having workshops and other short courses that we also expect these campus ambassadors to be part of. So the current coverage of this program and in this map, we have at least 70 plus countries where this program is currently happening. This is according to 2024. We're yet to get the list, the new coverage of 2025. And yeah, the places where we have the ones that are yellow. So you can see that at least in Africa we have also some places where we have this program going on. So we have various benefits for being in this program as a campus ambassador, and I must say that this program shaped my life as well and my new vision in planetary health since 2019, when it was initiated in my university. At that time, I was doing my first degree in environmental biology and health, and from that time when we initiated the program, actually led by our dear Melvin Otieno, when there were only 2 people in Africa who were enrolled in this program. And then later on, it started expanding. And in 2021, I was also part of them. And I want to admit that it really shaped my new vision and my skills. So these campus ambassadors are given the title of being champions of planetary health in their various universities, their organizations, and within their communities. So they are entitled to be champions of planetary health. And then there are various empowerment opportunities for these ambassadors. They are encouraged to make various collaborations, cross-cutting collaboration on their own campuses and between one campus to another campus and between one country to another country and between their continent to another continent. So there are several empowerment opportunities. Next is networking opportunities that are also available in this program. So because they are broader, they become part of the broader network of Planetary Health Campus Ambassador and even next generation network. They have a lot of opportunities to network between themselves and between their mentors and professional mentors, including professional programs that they become part of. So they have opportunity for that. And I've mentioned about professional development, and I will give a few examples, a reflection of Kenya's journey in this program. So this program started in 2019, and if you get to the Planetary Health Alliance website, you are able to see from 2019 this team and what they have achieved up to 2024 that is yet to be posted. So let me go directly to examples of transformative actions, and we're going to see how much youth involvement in planetary health can impact, starting from their community to their region and to a whole country and even to a continent. So I want to do a focus on what has been achieved in Kenya. So it took an approach of an interdisciplinary approach. And I'm saying that with respect to planetary health, this method involved integrating knowledge and expertise from various fields, such as environmental and social sciences, public health, climate change activists, education policymakers, and significantly, the ambassadors have used the different avenues to educate, organize workshops, seminars, campaigns, and they have achieved the agency of planetary health, which is the intricate link between human health and nature. So where did this begin? I'm sure that the various students who are currently enrolled in their various universities and could be listening to this presentation. So it started by developing an influential team of enthusiasts, at least a few people who really understands the vision that one person is having and are able to buy this idea and they agree that they want to go together. So in this picture, and I hope Ms. Malvin is also in the call. So the first person to the left, actually, that's when she was introducing this program to our university. She's to the left and I'm to the farthest right. And sometimes we sit down to brainstorm. We go into communities and we identify which problems are here and which planetary health approaches can we use to solve these kind of problems. And if it is community outreach, which approaches are we going to use? So sometimes we sit down in a round circle and we discuss in the best approaches to find solutions to this problem. So in that year, 2019, the University of Eldoret Planetary Health Society, for instance, one of the societies in Kenya, was initiated and recognized by the Planetary Health Alliance with an objective to educate the student community about planetary health so that the student can work to implement policies and solutions that protect human health and the health of our planet. And our vision is to foster a culture that promotes, protect, and improve our environment in compliance with safeguarding human health. And the focus is to collaborate with relevant specific field policymakers and the local community and other interested parties, support and implement variation of activities and to create awareness in order to optimize the well-being of human as well as the environment. So these are a few examples that I sieved out that will be relevant for me to share in this conference of the transformative action in previous planetary health campus ambassador cohorts. So for instance, they were able to design and implement class community-based climate change teaching on wetlands and climate change at the University of Eldoret, and also engage students and youths from informal settlements on sports for mental health during the COVID-19 pandemic in Kenya, where the young people in these informal settlements, now that there was a shutdown and no jobs and people are not really moving, and we realized that there were a lot of mental health issues that were being reported from this region. So one of the ways that was devised that will be appropriate is to engage them. As you engage them in sports, what they really like, then you can teach them about how to deal with mental health issues. There's also a full-day interactive workshop on solid waste management at the University of Eldoret, and also being part of the planetary health curriculum, planetary health education formulation at the University of Eldoret, introducing new students and faculty staff to planetary health. That was conducted by part of our 2024 Planetary Health Campus Ambassadors, and also engaging the community in tree planting during climate change movement in Kenya. There was pre and post planetary health annual meeting, student engagement, briefing them on what is expected, and also after the meeting, briefing them on the major achievements or major resolutions that were made during the meeting. There has also been regional and international conferences and workshops, research and professional development activities. So in the next few minutes, let me touch on a few of these pictorial presentation of these, and then I will end my presentation. So this is an example of class-based teaching and workshop that are initiated by the campus ambassadors. As you can see, various posts here, regional center of expertise in education for sustainable development, and the Sophia project, the last foot down there. So they are able to organize this class-based teaching on various planetary health topics, and they're able to share either with their student or with the entire community in their region. And this is a sample of also an initiative, and I'm happy Malvin mentioned this yesterday as well. It was a workshop, mental health activities, conservation initiative, and also collaborating with other like-minded organizations as envisioned in the vision of the society. So this was on a role of green spaces in dealing with mental health, and there were replanting sessions and also interviews with various faculty members. And I mentioned about mental health, sports for health activity, and also there was creative arts and focusing on dancing as well. We had one of the Planetary Health Campus ambassadors from one of the universities in the region, who is a professional artist, and he is able to use his arts and his and talent in shaping planetary health movement in the region. This is samples of conferences and workshops, including short courses and professional empowerment and development to the young people. And on left top, it was part of a program that was sponsored by Sophia Project and the Planetary Health East African Hub, and we were able to carry some of the campus ambassadors from Kenya to Tanzania for a workshop during the 13th Catholic University of Health and Allied Science Scientific Conference, and they're able to share their perspective on planetary health. There was also the 14th African Regional Conference, RC, that is Regional Center for Expertise Conference, that was hosted, and you can see one of the Planetary Health ambassadors in the middle sharing his perspectives. Collaboration with other organizations, this was with Wetlands International and youths engaged in wetlands, where at this stage we were able to advocate for inclusion of wetlands in national climate plans and also in national determined contributions. And I was part of this great team when I was an ambassador back in 2020 or so, and we were engaged in campaign on inclusion of wetlands, which I didn't define in this, but there are areas that are partially or fully covered with water, and we have some species of trees that grows there, like what you can see in your photo is one of the Papyrus apyrus species of plant, and also typha species which are able to absorb considerate amount of carbon dioxide from the atmosphere. And science research shows that if you compare same piece of land or coverage of wetland with their counterpart tree coverage, then wetlands will absorb more as compared to the trees, yet they are receiving very little attention. So that was an example of a campaign that was also led by young people. And I also mentioned about research and professional mentorship. So apart from the activities that they engaged in, they're able to be mentored by professors and experts in different fields, and they're able to develop themselves even in the field of research. And this is an example of a research that was conducted post-COVID-19. And several campus ambassadors from Kenya were involved in this research. And the title was The Role of Wet Markets and Backyard Livestock in Supporting Nutrition of Preschool-Aged Children in Kenya. Challenges from COVID-19 Influenced Closure. And at least 4 Planetary Health Campus ambassadors benefited from this, and they were mentored professionally in the field of research. And we had students from University of Eldoret, where I belong, and also from Moi University, our neighboring university, then Planetary Health East African Hub, and the then Planetary Health North Europe Hub, currently Planetary Health European Hub. Yeah, these are other examples. There was African Public Health Student Summit and Planetary Health Alliance conference that was hosted in Nigeria, in Africa, and several students or young people benefited from this, and we also able to give our presentation. There was also concluded in October 2024, African Climate Change and Health Responder course, which we encourage young people, as much as we receive these openings, we share it to the students so that they can be part of these great opportunities and short courses. And last year and I've seen Zintu has also shared about this. There was a pre-cohort conference, and students were engaged in pre-conference workshop, and several campus ambassadors and young people were part of this. Actually, large percentage of the attendance of these pre-conference workshop were youths who are enthusiasts in planetary health. So community engagement, I've mentioned a few of the things about this, and I will go directly to see a few of the photos where students go out and campaign about various planetary health challenges that they see in the community. So have campaigned against solid waste free cities, and there was a workshop on solid waste management. And the one that you're seeing on left down was our pilot first a workshop that we had, and indeed it was an eye-opener by that time. There was also a campaign on wetland climate change and biodiversity conservation campaign. And at some point, we also address our local media so that we can reach a broader audience. There was also this community that were impacted by climate change, and one of the campus ambassadors leading this together with Planetary Health East African Hub lead, Ms. Melvin, and other team members on arts and dances for climate change, visiting one of the communities, pastoralist community in Kenya, and teaching them about climate change. And this is courtesy of one of the campus ambassadors called Joseph Akite. So allow me to conclude at this point by saying that this program is very important, and thanks to the Alliance for having realized the need of including young people in planetary health movement. So these campus ambassadors are indeed influential agents of positive change, exemplifying the visibility of planetary health concept in their various regions of coverage. And there is a clear understanding of the connection between human and well-being and environment through multifaceted approach. There is further need to strengthen collaboration and expand research efforts, prioritize community engagement, and sustain educational programs, policies, and use of online platform for maximum impact. By building on success stories and implementing more activities, the visibility of planetary health in various regions can be amplified and the coverage can be enriched. So youth engaged in planetary health is not just beneficial, but necessary for sustainable progress and also for sustainability. So by empowering and involving young people, society ensures a more resilient and healthier future. So 2025, there was already an opening for open call, and it ended. The call was opened up to 6th of December, and students were able to apply for this opportunity, and selection was already conducted. We concluded the selection by 12th of December, and we're yet to communicate to them, the ones who qualify based on the minimum criteria for selection. Those are now other photos as well that were taken recently on the past and present planetary campus ambassadors that were able to meet in Tanzania. So thank you so much for your attention. I beg to stop at that point. Thank you.
Thank you a lot, Dr. Mr. Agan. That was a very, very important speech, and it actually took my eye because youth engagement is the backbone of every policy making strategy or everything that we want to include people in it and expand our network, expand our view of that of these scientific matters. So what comes to my mind is that when we are talking about younger people in Iran, we are actually dealing with a lot of students who are not that interested in planetary health or even other topics that are related to public health. You were talking about strategies to facilitate the collaboration of these um, younger people, and my first question is that how can we facilitate the, their engagement in these kind of programs?
Okay, thank you so much. I think the best approach to take is, as I was starting the presentation on transformative actions, I started by mentioning that it starts from formulating a group of a few people. At least if you're able to get two people who are interested in planetary health and who are able to buy the idea and who are enthusiasts. If you get two people, then you can be sure of four people. So you start by at least getting one or two people who are really interested in this movement. And then from there, other people will get involved and interested based on your success stories. So like in our case, we just started at least 2 or 3 people who are really engaged fully in this. And as we share our one success story to the second success story, then more and more young people were able to get more interested and come into it. Secondly, you can find what they like. Probably they don't want to listen to a lot of stories, and you are able to engage them in sports. You are able to engage them in arts. And during this, that's when you come in and share shortly about planetary health. I'm sure you'll get another 2 people, and then you engage them. You bring in people who have had these success stories, like from Kenya. You invite one person who has been engaged in this and is a young person, and if they hear their success stories, they'll get more interested in it. Thank you.
Yes, sorry to the audience that my voice was weak. Thank you very much, Mr. Ogan. My second question is that what were the criteria for the champion of planetary health that you were talking about? Because when we are actually performing or providing or planning on a strategy, on a gaming approach, we want to know what are the criteria to prize people, what are the advantages of taking part in these kind of programs. So I'm just curious to know what were in your mind when you were thinking of a champion in planetary health. What should the participants do to become a champion of planetary health?
Yeah, thank you so much. Being a champion means that we can read one or two success stories from this young person. That's why the title champion, meaning at least you're winning for planetary health. So when you apply for this opportunity and you get selected to be part of it, then it is true. I mentioned at least 1 to 4 activities, even if it is not 4, but you can do 2 activities that are having impact or can at least be part of the transformative um, uh, that can cause a change, whether it is in the community, whether it is within the student community or within the faculty. Then the title champion is true at this point because you are able to design 1 or 2 activity and it is successful and you can share your success story. So at that point, you are a champion. So I think that's the best way I can respond to the question. Thank you.
Thank you very much, Dr. Ogan. I wanted to continue to ask you a little more questions if you are okay with this, because in my view, expanding these kind of programs and actually participating in these kind of programs can be very helpful for our healthcare system. So as I mentioned, our students are sometimes have low interest in these kind of subjects, and they are more interested in the field of clinical fields, in field of diagnosis and those kind of pure medicine stuff. How can we actually stress on the importance of planetary health in countries in the Middle East that like last day Dr. Takian talked about how we are second most at risk of climate change and problems in planetary health, but we are not doing that much of programs to improve in it. So what is your idea about stressing the importance of these kind of subjects in our country?
Yeah, sure. It is very interesting that we have seen these not only now from your region, but several regions. Students who are involved in pure medicine really have difficult time, or rather within their schedule, they're not able to create more time to have other things coming in. And I remember when we were trying to talk about planetary health education in medical fields, it was also a little bit difficult, but there is always an avenue or an opening where we can involve in other activities like initiatives in planetary health, in as much as we have fixed curriculum and we have fixed time. So the best approach, or rather the point where we can start from in your own university, because I know there are various clubs or societies within universities. So we can come up with a planetary health club at that university, and that will be a good starting point. The next thing we can do is to organize a call, maybe 1 hour call. And if you are able to lead this, we can get in touch so that we bring a few people from Planetary Health Alliance. We normally do an introductory presentation on planetary health. And we have also various initiatives within planetary health. And I mentioned we have clinicians for planetary health. And now at this point, it will be the best point if we have maybe a 1 hour call to bring such kind of experts who are in similar fields, which will be a reflection of your university, whether we have students from medicine, we have students from public health, we have students from, we have the clinicians. So we bring experts from these regions who are also part of the planetary health, and they will give this talk. And normally 1 hour will be enough to do this introduction. So even during curriculum review, for instance, we always bring students from these fields so that we can share and see even within, and at this point we focus on the educators, that is the lecturers and the trainers, even within your teaching. For instance, we are talking about the impacts of climate change at the moment. And I want to give an example of what we have achieved in Kenya in actually initiating a short curriculum for medical students. So we are not creating a new thing, a new topic, but including some aspects of planetary health within your class to class or time to time teaching in your class. Even as you teach people about medicine and about any topic for the students from nursing and etc., you can mention something about planetary health within the curriculum that is existing. So it will be maybe a 10 minutes presentation or a 5 minutes section of your presentation on current impacts of climate change on health. And if you are able to articulate and they are able to see directly how climate change is impacting the health sector, or the health sector is contributing to climate change, or rather the students should now are able to have a clear understanding on the direct relationship between climate change and health, and so they can even advise their patient accordingly. You could be treating patients coming from a region that is known to be impacted by floods every time or are impacted by droughts every hour, and you can see that the issues that they're reporting are directly connected to the impact of climate change. So these students, I teach them because for sustainability purposes, we know the students can be agents of change because you'll teach them and they will go to various regions and they're able to implement even these planetary health approaches in their various fields. So they're able to tell these uh, patients that indeed you're coming from this region and clearly the health cases you have reported are directly linked. Maybe it's malarial cases. So you're able to ask this person, where do you come from? Then they will tell you the history of their place and you'll realize that indeed the effects of flooding, the effects of mosquito infestation is rampant in this region. So how do you encourage them? In a sense, you're giving them drugs, but then you can also tell them about where they're coming from. So if we are able to organize such kind of workshops and calls, then we can influence these students and they can clearly see the importance of having planetary health knowledge, even in their field of medicine. So we have other initiatives like our colleagues, I think Melvin or somebody had shared about Sophia, which has a component of the summer school where students come from various fields and they come together and they're able to share ideas and they're able to be taught on matters planetary health so that they can gain more understanding so that they can first be influenced and then they will be able to take it up. Further, there are a lot of teaching and learning material with Sophia, the Planetary Health Education Toolbox, which has several informative documents, whether they're presentations, whether they are videos, whether they are case studies, where somebody can learn and go through them and will see agency, the need to learn about planetary health, the need to learn between the interlinkage between environment and human health. So I think that will be a best approach. And so I repeat that if your students within your schedule, you'll have time, and it is possible that we can organize for a call, sometimes only 1 hour, and your students are able to spare this time. We can do an introduction to planetary health and bring in various experts from the fields that resonate to their field of study, and we can start from there. Thank you.
Thank you very much, Mr. Regan. That was very insightful, and we are very interested for further collaboration, especially our team, to use your methodology that you use for your campus in order to encourage and include younger people. Thank you very much. Now to Ms. Blue Card for the next speaker of.
So thanks a lot. I would like to appreciate on my behalf too, because you were responding to our questions eagerly. Thanks a lot. And these kind of actions are really initiative, and to take them into practice, we really need your experiences. So that would be really great if we could connect together as nursing as a student network, and that would be great honor for us. So, to our next speaker, I would like to introduce Mr. Daniel Maringi, Capacity Development Manager, Reacts Africa, Students Against Superbugs Africa, School of Pharmacy, Jomo Kenyatta University of Agriculture and Technology, Kenya. So, we are going to host you with the topic of AMR Ambassadors Program for Youth in Africa. So, today's topics are very focused on student engagement and youth engagement, and that would be really, really, really impressive for us to take part in this course. Thank you.
Okay. Hello everyone. I hope you can hear me. Maybe you can confirm. Can you hear
Yes,
me?
yes, we can hear you well,
Uh,
and your screen is clearly shared.
okay. Okay. Thank you. Thanks so much. So my name is Daniel Orenke, as been introduced. I used to work for React Africa, so I no longer work with them. I work with the Institute. But this is a project that we did at Students Against Box Africa, which was a 2-year project that started in 2022 and ended in the end of 2023. So I'll stop sharing my screen because of the internet, but I will reshare once I finish the presentation in case we have any questions, and also for a brief discussion. So just to offer a bit of context, the work that we do is mostly like Agana shared. So we do have a lot of programs that engage young people. And the reason for this is because we haven't worked so much in planetary health, but our work kind of focuses a bit on when we talk about global health security, especially antimicrobial resistance. And I did happen to attend some of yesterday's session and in the afternoon and evening. And I think one of the things that was actually coming out was drug-resistant infections, especially issues to do with MRSA and all that. So our work is mostly targeted towards antimicrobial resistance, and this is an area that has not received a lot of traction for, despite the big threat that it actually faces. And we did manage to connect with the Planetary Health team. So I believe what I'm sharing today is just to showcase some of the models that we use in terms of engaging tertiary level students and early career students, with the hope that it might trigger a bit of discussion, and also we might learn something from this, and also learn from you what you've been doing. So to start off, we have a website about the program. So after my presentation, I'll also share the website for the program, so that in case you do require more information about it, you can also see it in the website. So the reason why we started the MR Ambassadors program, which was a program that actually ran in 14 countries within Africa, it was a hybrid program whereby we had a lot of about 4 months of virtual training on technical areas of AMR, infectious diseases, and other key areas that touch a bit on AMR. And after that, we had another 3 months of project management training in terms of equipping the students with skills that can enable them to go ahead and implement projects at their communities, in their schools, and also in their clinical settings, and also in other work areas that they work. And after that, we had quite a prolonged period whereby we offered grants to the different students who engaged in the program to actually go ahead and implement a project on AMR. And that's usually the model for the programs that we run under the organization. We usually do a lot of training, and after the training, we reinforce it with experiential learning, whereby we award students grants to actually run programs or projects that are the areas of interest, of the areas of passion, and also those that actually cover, the major gaps that they have actually been able to identify within their communities. And just to offer context, currently we have a program that is running now, not focused in the entire Africa, but focusing a bit on Kenya. It's called the Fahamu Vida program. Fahamu Vida is a Swahili word that means be aware of antimicrobial resistance. We actually launched it last month when we had the World Antimicrobial Awareness Week, that is designated by WHO from 18th to 24th November to create a bit of awareness on antimicrobial resistance. And the program is actually running in 9 counties within Kenya, and counties are the sub-regional, let's say the regions or the sub-national governments within the country, and we are working with students from 9 universities within the country. And for our projects, just to share a bit of model, we'll talk about it later, is that we usually have an open call for applications whereby students do apply in groups, not in individuals. So kind of like the Planetary Health Ambassadors program, but now in a group setting. And one of the reasons why we focus on groups is because we do like to see a bit of multidisciplinary engagement, whereby issues such as AMR, planetary health, are not issues which are cadre specific. These are issues which do require us to engage from a multidisciplinary context. Having a pool of people with different expertises actually coming together to come up with a common challenge. If you can see in the image that I've shared for our website, it actually has a portfolio that shows what different disciplines can actually do when in regards to tackling antimicrobial resistance, thereby where you see the engineering sciences. And when you talk about antimicrobial resistance, which is more of a healthcare challenge, a healthcare threat, or both in human health, animal health, and environmental health, most of the time we do think that maybe the people who are really supposed to engage in this or alone are just the healthcare providers. And apart from having that pool of expertise together, whereby different disciplines come together in terms of a group, you also find that at the same time, it triggers a bit of interest among the students. I think that was one of the questions that was asked, was directed to Agan. And we found that when you're able to bring in students from different courses, they usually have a bit of interest just to see, there's that curiosity, what others are doing and what we can learn from them. And it also creates a bit of a different structure from what happens within the classroom setting, because in the classroom setting, then you have a lot of, just to prevent that monotony, which sometimes it's kind of a barrier, an obstacle for students actually engaging in some of these wonderful initiatives that we develop. The target audience for this project, as I've said, was tertiary students and early career professionals. We were in different countries within Africa. So it was more of a pilot project. And the reason for this project was because at that time we were working on a scale-up strategy on how we can engage young people from a more scale-up setting, which went ahead to actually design a coordinating platform, which is still under development, which was one of the key learnings of this program. And the 14 countries that were engaged were mostly from Western Africa and Eastern Africa and Southern Africa, particularly Nigeria, Ghana, Kenya, Tanzania, Uganda, Zambia, Zimbabwe. We had a bit of Namibia and Burkina Faso and some countries within the Francophone region. And so just to cover a bit in terms of this is our theory of change or our ROG frame. And it might be a bit unclear, but just to focus on the aim. The purpose of this project was to generate more AMR interventions and actually increase support for tertiary level students in terms of AMR engagement outside the mainstream AMR sciences or the conventional areas that are actually meant to, cover AMR work. So we were trying to see how then do we bridge these and actually expand the scope of AMR engagement beyond the traditional disciplines. Still on the same as I've said, see how we could actually increase collaborative and interdisciplinary engagement. And the purpose of this was to see out of this transdisciplinary or collaborative engagement, are we able to spark new interventions or, unconventional methods of actually dealing with this public health challenge? And also kind of create a ripple effect in terms of AMR awareness and engagement. And this is through one of the things that we've learned from our work is that one of the major ways to engage young people, especially tertiary level students, is not just through maybe the capacity building, but it has a lot to do with inspiration. I think that is what really has worked a lot for us, whereby you find that the moment you have people doing something, it kind of also inspires others because it gives them the confidence and the motivation to, believe that they can actually go ahead and, do what others are doing. And our program also, based on the small project that I've said, which are usually form part of our experiential learning phase, whereby we give some grants to these student teams. You find that apart from them implementing a project, we also support them in terms of creating structures. For example, an AMR club within their setting, registering a community-based organization or an NGO based on their priority and also based on their interest. And such sets precedence for structures in terms of what young people can actually do in terms of engaging AMR. And so you find this actually creates a ripple effect in terms of AMR awareness and engagement through that inspiration and through that extension of knowledge and extension of structures in regards to the same. So since this just offers a bit of a model, so as I said, we did have a lot of training, and then we did have the project had 3 phases. And for us, as we engage people in AMR, AMR is a bit of a technical concept, quite complex in particular. So we don't start with, and I think it's the same case for Planetary Health. So we don't start, we don't just capacitate them on the technical aspect of AMR and how it and the holistic component of it and how it actually affects people and all that. But after doing that training, similar to this program that we are doing currently in Kenya, we go ahead and actually train them or help them strengthen their skills in terms of issues to do with project management, monitoring and evaluation, grant writing, reporting, design thinking, systems thinking, before now we go to the experiential learning phase. And the reason for use of this model is because over time we've realized that if you just capacitate people on a particular topic without offering them the necessary tools to actually do something, then it becomes very hard to sustain, those actions. But the moment you train people on some of these things, the soft skills, which really are not part of the technical part of it, it actually they are not just, they are equipped with the technical know-how so that they're able to design, so that they're able to convey the right information, they understand what they want to deal with, but at the same time they also have the capacity to go ahead and implement our project or initiate some action. And also through a training of training approach or a TOT, or just they then serve as champions who then go ahead and motivate or train other people within their settings. So for us, we do have a self-determination theory. We work with a bit of models, and one of our models is that we don't prescribe interventions. For example, we don't really like tell people, okay, after we give you a grant, okay, do this and this project. So for us, we leave it free for them to think about, what works in their setting, what is the interest, because one of the things to sustain action with young people, I think, is also, for example, in planetary health also is also to recognize that, the planetary health concept is field is very wide in particular. And so, and people coming into this, they're also coming from different professions, you know. And so everyone, when they're actually engaging something, they usually have an interest or a reason as to why. So the moment you give that people that autonomy to actually determine what project they want to engage with, or which part of these bigger challenge they're actually willing to focus on, then and equip them in regards to that, it kind of also builds in a bit of sustainability. So that's a study that we are currently doing, whereby we are investigating some of these components in terms of trying to sustain some of these actions. And the reason for this is because we realized that out of this project that we did, and maybe some other projects that we've done, where I can also maybe share links to that you can actually visit. We've had in Africa, actually Africa has a very large number of upcoming initiatives on AMR, be it AMR clubs at different universities or AMR or One Health clubs. And, you know, we have a lot of initiatives, some not really formally structured, but just trying to, led by young people, trying to address AMR. And at the same time, you have a lot of youth-led organizations within the continent coming up. And these are self-directed, you know, organizations. And I think, and because of this model that we've been using, we see there's still that sustained momentum of people actually working in this. And it's because, so we are trying to investigate whether, you know, the link of some of these models that we use, and in regards to, you know, what is actually happening within the African continent. So just to share a bit of summary about the project, as I've said, it was an 18-month, it was a hybrid project. And the reason for hybrid is because since the project was run in different African countries, so what we did, the training, most of the training actually happened virtually. We had a portfolio of AMR experts. I'll share the website so you can see them. And they were from actually not just Africa, but we also had experts from different parts of the world too, Asia, Europe, the US, Australia, and all that. And the reason for this was just to promote a bit of cross-learning, whereby we're also able to see what is happening in other areas and what we can actually borrow from that. And the same time, we had a bit of coaching or mentorship arrangement within the program, whereby you see this, we had 14 teams, as I said, from 14 countries, and each of the team was actually linked to a mentor or an expert in the project that they actually wanted to go ahead and implement. And each team was also, we also tried to work with them in terms of offering them support so that they're able to get a local coach within their country. For example, let's say if it's Ghana, trying to source around and also trying to use our networks to see whether they could actually get someone who is within the countries who can actually, you know, serve as their coach and help them in terms of accelerating some of this work that they're doing. Apart from that, the project, we did develop a consortium of 12 organizations. And the reason for this was just to see that apart from us implementing the project, we have a bit of wider support in regards to, you know, organizations actually willing to come in and support the project in some of these some of the different areas that they actually work on in the area of AMR. And one of the things that you find is that out of these, we're able to have some of the teams actually, you know, as I'll share, get a bit of further financial support to actually go ahead and, you know, run the different AMR projects that they actually wanted to focus on. And so that's a summary about the project. And as I said, we really try to have that multidisciplinary approach to it in terms of having students from diverse academic backgrounds and a bit of emphasis on also trying to see, what can some of the students from the non-health disciplines actually bring into both. And I believe it's the same case for planetary health, whereby, some of the interventions that we want to develop, you need people with expertise in different areas. For example, in law, a bit of technology to it. But one of the things that we found out is that for us to actually attract the attention into the project, we had to be very intentional in terms of kind of skewing the project towards them. And this is because, you see, our projects are usually open access to the public, whereby we usually especially launch an open call where anyone who feels interested can actually apply. Then we have a very rigorous selection process that considers different factors, also depending on the program design. And for example, for this project, what we actually tried to do was we did a lot of emphasis even in our website in terms of trying to showcase how different disciplines can actually contribute to antimicrobial resistance interventions. And the reason for this is because, you see, when you roll out such a program and put it out there, and even for some of the projects that we've run, even at a physical setting or at a grassroots level, for example, when you organize even in a university, or you kind of launch a club on a thing such as AMR, you will find that people who gravitate towards these are people who relate with this subject, and even for such applications, you'll find that you will find a lot of a lot of applications from the same disciplines. And one of the things that we really wanted to do was break that bubble of whereby you engage people, the same people from, just try to move beyond those echo chambers. Like you engaging the SUI, really placed a lot of emphasis on this, and a bit of also on the team structure, whereby, for example, would recommend or encourage for our team, try to also have that multidisciplinary phase. And as I've said, it actually encouraged a lot in terms of collaboration, innovation, and sustainable structures. This photo that you see here is one of the teams that we did engage, and it was a team from Makerere University, based in Uganda. And they went ahead to found a club within the campus called Makerere University AMR Club. And the reason for this is that we ourselves didn't really go to the university and form the club. Sometimes both top, we utilize a bit of in most of our projects, we utilize a bit of bottom up approaches. And when I mean bottom up, is whereby for some universities we can go, and this is what we used to do before. We go to a university, talk with the university administration, and inform them that we actually are doing this project on antimicrobial resistance, and we want to form a club within this university. And it's the best way in terms of formalization, I would say. And in terms of you coming, but you see, what we realized with such a model is that at the end of the day, the self-ownership of such an initiative is usually hard to to create, because you find that if you're the ones coming and you're the ones starting the club there, then there will always be a bit of external reliance towards you. And the moment maybe you kind of stop actively supporting this intervention, then it becomes very hard for it to sustain itself. So after we saw this challenge, what we decided is, like, let's try a bottom-up approach, whereby we have such a program and we invite students, and we equip them and capacitate them, and then have a conversation and ask them, what do you want to do? And they tell us, we want to create a club. And we tell them, okay, if you want to create a club, then what we'll do, we'll support you. Just go through the formal process, work with the school administration, work with the dean of students. For us, we'll just be here behind you supporting, but in terms of registration, in terms of leading all this. And so by the end of the day, both approaches, you do get a club, as I would say, but the model is quite different and the approach is quite different. For example, for us, we are no longer active in Makerere University AMR Club anymore, since we usually delink ourselves from the projects that we learn, just to ensure that they're sustainable and to prevent exerting an overbearing aspect on them, which can actually prevent their growth. So we do connect with them, have a bit of interactions with them, but they are independent entities on their own. And one of the things that we've realized is that, maybe let me give an example. For example, the Makerere Club, actually, they did receive a grant almost last month of almost 10,000 USD, a bit of it 500, and now from an organization called the Trinity Challenge, and this is an AMR club that I'm talking about. So they have received quite a significant amount of funding, and to implement some WASH programs in secondary schools and primary schools within Kampala region in Uganda. And if we look at this, is that the point whereby like a club is able to go to an extent of actually receiving quite a sustainable amount of money, and also joining platforms. For example, the club chairperson was actually invited to we had the high-level meetings on AMR, which have been happening quite a lot this year. For example, we had the United Nations General Assembly high-level meeting on AMR in September, and we had the interministerial conference whereby ministers from across the continent then gathered in Jeddah, Saudi Arabia. And we also had a civil society cluster that is run by food and agriculture organizations, and the club was actually invited, and they had their representative in this high-level meeting. And these are some of the milestones. They also that I'm just to point, and this is just an AMR club within a school, and this is just to share in terms of how when you have a bit of self-ownership of what the students are doing, and they don't feel a bit of external forces that are directing them to do this or do that, but they work from their own initiative and they're able to see their growth, then that really helps a lot. So that was just to share a bit of context in terms of why the multidisciplinary engagement. Yeah. And as I said, the project was implemented in 3 phases. Now to share a bit more, whereby the first one was in terms of AMR, a lot of AMR technical education. And then, as I said, we had a bit of lead acquisition of project management skills, and a bit of leadership empowerment still on the same. And during this time, what we also did during this phase is that we had simulative projects. So simulative projects are whereby we did so these different teams, the 14 teams from different countries, actually, they applied from a team. But what we did is we mixed them up, whereby we did a survey in terms of now them as individuals, what is the interest areas, and then we mixed them a bit from what they actually shared, and we formed other groups, and now not just multidisciplinary but inter-country groups in the phase 2 of the project. And here we were looking at a bit of cross-learning. So what they did is that in preparation for this project that they were to cover in phase 3 of the program, we actually did a bit of simulative training, whereby so we regrouped them into different groups, and they actually went ahead to ideate a project that they would actually do. And the reason for this was just to ensure that, in as far as we have the project is actually focusing on them coming up with intervention in their different countries. From this project, given the multi-country representation, we're able to trigger a bit of cross-learning among them. And strengthen their network so that even beyond the program, they can also be able to collaborate on some of these things that they do. And we've seen this even beyond the program. For example, there is a team that was during the simulative training, and so their focus was on science communication in terms of AMR framing and all that. And they did their simulative project just like the rest. Then we had a pitch. And during the pitch, what we did is that we had a judging panel, and the three best simulative projects were actually awarded. But for them, what they did is that they actually, even after we ended this phase 2 of the project, they went ahead to like work further and apply for a grant. So they did receive a grant from Boston University and to actually run a project. So it's actually something that they've been doing. And this is a team with a multi-country setting in regards to the same. So on the left, what you can see on your right, those are some of the different teams. Just a few of them engaging in a bit of sensitization. For Kenya, there you can see that was they were working with primary school students in some of the urban informal settlements in Kenya, and their focus was on more on how to ideate and work with them in terms of easily uptaken ways of wash or to improve hygiene and water hygiene and sanitation, given the the water inaccessibility in this region, because of the structure of urban informal settlements and the poor waste management and all that. And so they were like brainstorming with the kids and all that, some of the feasible ways that they could actually promote hand hygiene. Nigeria, them engaging schools, same with the team in Zambia there. Uganda, they were engaging tertiary students. The team there in Rwanda engaging farmers. Ghana participating in a roadshow. Cameroon, that's the team, and Uganda, but we'll see more. And similarly to what we are doing, apart from that, we also had so in the phase 3 of the project, we had a bit of a bit of follow-up on the same, and still on the same, we had the teams actually, as part of the experiential learning, do a bit of sensitization during the World Antimicrobial Awareness Week in 2022, and this was still in phase 1, but it was just to prepare them a bit for phase 3, whereby where they could actually roll that. And we did award the best teams. And for example, the team on your left there is from it's called the Flemings, and they're from the University of Mina. And they went ahead also to form like an EMR club within University of Mina. And on the left, you also have a young ambassadors team from the University of Ghana, and they actually went ahead to also form an EMR club. And similarly for these clubs, they are a bit of autonomous, semi-autonomous clubs, just like the case study that I shared for Makerere University. And these are a bit of maybe a bit of numbers. Sometimes you're told it's good to showcase a bit of numbers in terms of the reach. And when we are still trying to evaluate the success of these interventions, and the reason I say this is because for such programs you really can't measure the impact of the project right to when it ends, because you see some of these outcomes are still emanating as we go on. So one of the indicators that we were trying to look at was in terms of how many number of people out of the different activities that they did they actually engage physically? Did they actually engage physically? And these are some of the countries which were quite proactive. Also to mention is that in the process also for such very long programs, or we also had a bit of attrition rate whereby some teams actually dropped off, and it was also a learning lesson for us. A project that takes close to 18 months, close to 2 years. You find that there are a lot of changes that happen in the process. Some finish school, some get employed somewhere, and all that. So we did experience a bit of attrition also in the same, but at the end of the day, we were still able to finish up with quite a significant number. And these were the total number that were reached by each team, and this was through physical engagement. And this was very shallow in terms of analysis. As I said, we are still trying to analyze some of these other areas, especially in terms of issues to do with behavior change, and in terms of some of these things, they actually take time and quite complex to evaluate. So this was just to share a bit of the impact, and the reason I show this is because you see, for a team to actually maybe reach around 7,000 people, that actually means they did have a lot of it kind of requires a lot of motivation for them, because this is actually engaging not just in one project but in multiple projects throughout their implementation phase, because these are the people in terms of engagement in this. When you say about reach, some of the criterion that we're using in terms of evaluating this was people whom you actually meet, you train them, you have sessions with them, and we have records to actually showcase all this. And it means there's a bit of intrinsic motivation to actually doing this. And still on phase 3, as I said, we focused more on creating more sustainable structures, and we did have this reach, but you realize that most of this reach actually emanated afterwards, after like creation of sustainable structures. And this is because for phase 3, when you talk about, we try to encourage them and to see the benefit of, it's more impactful. Maybe you might not have a lot of reporting to do then, but it's more impactful in terms of creating sustainable structures and institutions, rather than just doing campaigns and outreach, because of just looking at it from a sustainability viewpoint. If you register a club today, you might not be able to do much, but if the club has good leadership, good transition structures, buy-in from the school administration, then that means the club can actually engage in many more activities beyond this. So as I said, we had local coaches, and we also connected each group with a mentor who was an expertise in what they were actually doing. And as you saw, we also had like a consortium of a number of organizations, and this was to ensure that we have quite a good stakeholder engagement to support them in terms of forming the organization structures, and also they have somewhere to to lean on. And on your left, what you can actually see is that we have we had 2 groups from Ghana, and these are the group, as I've said, we had these CAFA Young Ambassadors, but the other team that we had from NAST. NAST is Kwame Nkrumah University of Science and Technology. For them, they decided, since they were in their final year of school, a bit to complete school, and they actually completed school before the project could actually elapse. For them, they actually decided to focus on, rather than maybe form a club, they decided to see what they could do after they leave school. And so they went ahead to register an government organization called Aware Ghana. So even if you check the website, they still do a lot of projects even during this while. We actually did some work with them, and now they are they are their own independent NGO working with young people in Ghana. And this is just to show you the that importance of creating structures, which in a way are a bit delinked. And I know for us most of the concept use are they are hard, and especially when it comes to delinking. But you see, what we did is that, okay, we did support them. They went ahead and funded their own NGO, non-profit in Ghana, and they're now doing their own work. We are still there to support them where that is required. The photo on below is for another team in Nigeria called the AMR InterVarsity Program. So the photo there that you shared is a conference where we bumped in each other in one of the countries in Africa. This was Zambia, and we were invited to the conference, and they were also invited, and we are like, okay, and they're also there to showcase their work that they're also now doing, and it's a good moment seeing that people you actually worked with or you actually inspired have gone ahead beyond what you actually train them, and they are now running their own independent entities. So these are some of those. For example, we had the Makerere University Club that I shared about. We had another team from Uganda actually running a bit of research. Burkina Faso, we had a team called Ajram who are trying to do a bit of work in French-speaking countries. Cameroon, they did a bit of radio work. Tanzania, we had a team that went ahead to form a handbook on training secondary school students, and another one was actually doing a bit of community engagement. We had the team from Kenya, which was trying to do the one that I shared, trying to look at how to engage young people in hand hygiene in informal settlements. And we had another one that was actually seeing how they could try to incorporate a curriculum into the AMR into the curriculum in one of the universities. Project Resist Ghana is the one that went ahead to form the NGO, Aware Ghana. We have the Kafa Young Ambassadors who registered an EMR club, and we have quite a number from Nigeria who went ahead to, most of them in Nigeria went ahead to form AMR clubs. And apart from these, as you can see, as I said, when you look at this, they seem a bit very far from each other, disorganized in course whereby, just interventions vary, very different interventions. And the reason for this is because our model is we don't prescribe for them when we, for example, you are to do this, okay, let's all create clubs, and the reason we do this is just to for this project was just to research more in terms of what I've said about giving people that autonomy to actually do what they feel is in their best interest, their passion, and what they feel that the people they're working for actually want to. Apart from that, we had a number actually from the program and through the consortium of organizations that we had actually get scholarships at Cambridge University in the UK. We had 3 actually get grants from this. The one that I've shared about Boston, another one by some philanthropic organizations within the US, and then 3 actually went ahead to pursue actually still in the program. They actually got jobs in the AMR field. And this is just one of the handbooks that actually was launched the other day from one of the teams in Tanzania. And as you said, that inclusion of a broader perspective of widening the base of engaging more students rather than the non-medical. And for us, it's different, I think, from maybe what happens in Planetary, because for us, we find that most of the people who apply are usually medical students. And medical, I don't just mean people pursuing medicine and surgery. I mean, people pursuing nursing, pharmacy, microbiology, and all that. And this outcome, as you can see, this is a team here, the team from Tanzania. And actually, when we were with the Planetary Health team in Tanzania, once we left the conference, there was a conference there in Catholic University. I think that Agan has also shared. I went to another part of Tanzania to since this is a project that we're also running with one of the teams that emanated from the program, but now has gone a bit to be, it's also an autonomous initiative whereby I'm working with them as an advisor. And what they did is that they did develop a book handbook that they are trying to mainstream into the the Tanzanian curriculum. And currently, what's happening is a bit of piloting and trying to do a bit of studies that can help in terms of informing that policy uptake. And they actually met the minister during one of the exhibits that they did, the minister for Tanzania, Honorable Kasam Majaliwa, and they are still in contact with the minister and the Ministry of Livestock just to see whether they'll actually get more support in regards to this. So the reason I shared this, and I think I was invited to share this, is just to showcase that there are different models of how we can engage, young people, the youth. And the work that we did was in antimicrobial resistance. But these are models that we can uptake in different of entities that we run. Plan in different spaces, planetary health, and all these and other areas that we work with. And the key thing that I wanted to maybe share across was not really the work that we did in EMR, but the model that we used. And it had its own few of challenges that I've said, for example, the attrition and all this. But at the same time, it also has been able to kind of trigger a ripple effect in terms of quite a vibrant and a community of that a growing community of young people actually like advocating a lot in terms of AMR. And right now it might be something small, but you see that shift. These are people who will then go ahead to work in maybe the health sector and other areas. These are the key decision makers who are coming within the next few years. And in a way, it might be an inflection point in terms of behavior change and all that. Yeah. There are different models to it. This is one that this is one of the projects that we actually explored with this model, and we've used previous models in different projects, and they have had different outcomes. But I think this has been our most successful model that we used, and we actually seeing a lot of impact from it. So these are the people who did support us, and some of them are actually part of the consortium. And we also thank Sophia, Melvin, and team for also offering us that opportunity to also showcase our work. And also we hope that with the Sophia team, and also now with the team from Iran too, we'll be able to maybe engage in further discourse in terms of how to engage young people, and not just in EMR, but also other areas that you actually engaged with. So thanks so much for the opportunity, and I now open the floor to any questions that you may have. Thank you.
Thank you very much, Mr. Waringi. That was a very insightful speech by you, and I used a lot of that information, especially for the future courses that we'll provide for our students. We'll consider the points that you underlined in your speech. I just have one question from you, because you just had a very, very holistic speech and it was very complete, so there's no vague points in it. I just wanted to know that when you say there are both non-medical students and medical students in your programs, do you use the same education for them? Because sometimes there might be some specialty based information in that.
Okay, thank you. Yeah, so what we do is that we use the same curriculum, but what we do is that we simplify it as much as possible. And this is because, some medical students might have a bit of prior knowledge based on their own technical training that they actually undergo within the universities. But we try as much as possible to simplify the curriculum, for example, what we had. And maybe to the medical students, it might appear a bit of repetition of some of these things, so they are kind of communicated in a very simplistic way. But I said, for us, our projects are very much intentional towards those within the non-healthcare aspect. And the reason for this is because already there's an inherent interest in the people pursuing medical courses, given that, this is their common area. So we try as much as possible to tailor things towards those students who are not coming from a healthcare background. I hope that addresses the question.
Thank you very much.
Okay, I see another question in the chat. Maybe can I respond to it?
Okay, yes, of course.
Okay.
I just wanted to ask you another question. What are the challenges and difficulties you faced while implementing this program?
Okay, yeah, I see the same question in the chat. So one of the things that I would also like to highlight was one, it was a regional project. It wasn't a country-specific project. So one of the key things there is the administrative hurdles and a bit of getting permission from the different countries, and different countries have different administrative and bureaucratic structures. So that was one of the challenges. And as I said, this was more of a pilot, and we did this project because we were trying to investigate some of the ways to actually engage young people. So you realize that we did very yes, it was from each country, and so that was also a bit of a challenge in terms of us making a very much significant impact. So you realize that, for example, for example, for each country we have maybe 2 teams and very proactive, but then that doesn't kind of reflect the entire country. And also how the project was actually organized, it's easy to it's quite difficult in terms of systemic uptake and scale up of such a project. For example, expanding this towards having that model actually scaled up within the entire country. And so that was also another challenge. The other challenge that I also mentioned was it was quite a lengthy project, so there was a bit of attrition, whereby because of maybe different interest in some of the students actually being engaged in different things. So we had a number, almost 20% actually, drop off from the project because it was also quite lengthy. The other one is, I think, monitoring and evaluation, as I said, because initially what we had put within our indicator framework, we had to, our monitoring and evaluation strategy, we had to reshift a bit of this because, we see new things that are coming. So, and also we didn't really anticipate maybe to do quite a prolonged monitoring and evaluation, even beyond the scope of the program, just to, try to get a whole aspect in terms of the try to get a hold of in terms of the outcomes that actually are coming from this program. So monitoring and evaluation has actually been a key challenge. Some of the things that we've done now is that we are trying to be a bit country specific. For example, we now implementing a kind of a similar program, but now in Kenya alone. And the good thing with this is now that based on the key learnings that we had from this pilot, now we are trying to focus primarily on one country and see whether can actually create centers of excellence in that country, in this country, and then actually advise different partners in the other countries who want to take up this model to actually also learn from the same. Yeah, so I hope I've addressed the question.
Thank you very much, Mr. Varangi. No, there are no more questions. Thank you for answering our questions, and it was a very, very insightful speech.